coronavirus vaccine. But as Dr. Maria Simber reports, releasing a vaccine before it's fully tested and ready could have negative consequences.
In a rush to beat COVID-19, a vaccine could be made available through the Food and Drug Administration's Emergency Use Authorization.
Emergency use authorization is when the FDA in a crisis will review the data that's been provided to them.
Different from full FDA approval, this authorization speeds up getting tests and drugs to market for specific use for a limited time. Typically, a series of bigger and bigger studies of safety and effectiveness lead to FDA approval.
It can take many years for all of that. We have somewhat accelerated that path.
The U.S. government has invested $10 billion in 8 different vaccines under development, buying millions of doses ready to go if the FDA gives the green light, possibly by the end of the year.
I just wonder if we could really get that many people and the data and the outcome to really evaluate it.
Moving too quickly could have drawbacks. For instance, people may be hesitant to get immunized if they perceive the development process was too hurried.
You can really run the risk of the population not trusting that a vaccine is safe or effective. So we really need people to step up and want to receive a vaccine to stop spreading it.
There could be unforeseen side effects.
We do report those back to the FDA, and then they take that into consideration on whether that vaccine or that treatment should remain in the market.
A vaccine with only weak effectiveness could be a problem too.
They may have a false sense of, I've been vaccinated, I can't get COVID, therefore I can do what I want.
Transparency will be important to show the public why a vaccine is being put forth. The end of the year may be too soon to get there.
Is 2021 a reasonable time? Sure, if we have the resources and we dedicate our time. I think all of us are excited for a vaccine, but we don't want to rush it.
A concern, she says, many in the medical community share. I'm Dr. Maria Simber, KDKA News.
This is an emergency, Mr. President. This is an emergency. And Donald Trump and his FEMA should treat it as one. If I were president today, I'd direct FEMA to make sure that our kids K through 12 get full access to disaster relief and emergency assistance under the Stafford Act. I'd make sure that PPE and sanitation supplies for school qualify as emergency protective measures, which is a phrase they use, to fully be eligible for federal assistance. On top of that, I'd be working with the leaders of Congress now, today, to pass emergency packages for schools so they have the resources they need in order to be able to open safely. Money for ventilation. I heard that a lot when I had all those healthcare experts up on the Zoom. Money for ventilation and other health measures, but also more money to hire more teachers. Every recommendation we got was they should be dividing into pods, smaller classes. Smaller classes mean more educators are needed. Keeping classes socially distanced, small. Money for more psychologists and counselors. I introduced legislation a long time ago I proposed legislation a long time ago. We have one school psychologist every 1,507 children in school. And the health care, the mental health that our children need now, the anxiety they're feeling at home and going to school, not being able to go to school. The nation's superintendents of schools have estimated that they'll need at least $200 billion to support K through 12 schools throughout the year for safe reopening. And we need the money to hire educators as well for our four-year colleges and universities, for community colleges, for HBCUs, for minority-serving institutions. Democratic leaders are ready to get this done. They've already proposed such legislation. Mr. President, where are you? Where are you?